Hi, this is Representative Hannah Kane, and welcome to Conversations with Hannah. I want to start off by thanking Mark Serra for coming into Shrewsbury Media Connection to record this show with me today. It's hard to believe that the last time I came to you in a Conversations with Hannah was on Sunday, March 15th, when I convened a panel of my colleague, Senator Mike Moore, as well as Superintendent Joe Sawyer and School Committee member Sandy Fricks, Assistant Town Manager Kristen Lass, and Selectman Board Chair Mo DiPaolo, as well as Steve Vigent, the Board of Health Chair, and Dr. Michael Hirsch, who is the Medical Director for the City of Worcester. We came to you on the 15th in a very different place and time. We were telling you what we knew then, and I'm coming to you today, Tuesday, April 7th, telling you what I know now. I wanted to get together with you through this medium so that you could see me in person, and so that I could relay to you personally what is some of the work that's going on at the local, state, and federal level to battle this pandemic that we're facing as a country and a Commonwealth. The federal, local, and state governments are all very hard at work. I'm really going to focus in for the most of our time on what's happening at the state level, but I do want to let you know that from a federal level, we have been in touch with our congressional delegation. Last week, Senators Markey and Warren hosted a call for legislators, and they walked us through all the different elements of the federal legislation that had been passed the week before, the CARES Act. We have been in fairly continuous conversation with Senator Markey's office, who's been sending us updates. Congressman McGovern and I have spoken often. And I also participate in a call on Wednesdays with the White House, the team that is working on the COVID-19 response. They host a state leaders call. There's usually 4,000 to 5,000 people from across the country who are working in some sort of capacity in government. And the folks who are on the call are the folks that you see pretty much every night when the White House does their briefing. So the Vice President has been on, Dr. Birx. This last week, Dr. Anthony Fauci was on, as well as folks from Treasury who were also walking us through what some of the CARES Act pieces included. I take advantage of every opportunity on any of the calls that are put out to us, whether it is from the federal government through FEMA or the working group at the White House, to get as much information as I can to understand what's going on. In addition to those conversations with our federal partners, there is an awful lot of work that's going on at the state level. Hopefully you see a lot of that happening. The governor has hosted daily press briefings. This last weekend, Saturday, I believe, was the first day he hadn't had one in probably three and a half weeks. They are trying to communicate directly and letting people know what is going on. Today, the Republican caucus members had caucus with the governor on the phone and the lieutenant governor, and they briefed us on some of the different elements and things that they're working on, things that will be coming out in the next few weeks as we continue to battle this, as well as a status update. One of the things that we talked about today with the governor was where we were at as a Commonwealth with the personal protection equipment that is needed by those on the front line of this crisis, whether they're in a healthcare institution or working in a congregate care setting, a dentist office, a doctor's office, anyone on the front lines who could be exposed to somebody, and certainly our first responders as well. The governor gave us an update on the masks. I'm sure many of you saw the pretty emotional landing of the Patriots plane the other day at Logan and the unloading of the 1 million masks that came in. A portion of those masks were sent to New York, about 300,000, as well as 100,000 to Rhode Island. The balance are for here in Massachusetts. They were immediately sent to Marlborough, to the National Guard facility there, where they were counted and then distributed out. About 337,000 of them, the masks, were distributed all across the Commonwealth to all of the different facilities that were in need. And they will continue to be contributed across the Commonwealth as the need is there. In addition to getting the actual mass in, the other piece of great news was that we also got one of the 4 machines in the country right now that can decontaminate the mass. That is in Somerville. The mask, the N95 mask, can be used because we have this decontamination machine 5 to 10 times instead of just once. So the million masks multiplies to 5 to 10 million masks by having this machine here. And I really want to give credit to the Baker-Polito administration for all the work that they are doing, not only to chase down every possible lead on personal protective equipment, but also thinking out of the box and being aggressive in terms of what are other ways that we can extend the life of some of this equipment in a completely safe way so that it can be reused in our healthcare system. In addition to the masks that I think we're all well aware have been in constant need, the other piece that I'm sure you've heard a lot about is ventilators. The Baker-Polito administration has asked the federal government for 1,700 ventilators. That is what we assume we're going to need. So far, we've gotten 100. We've been told by the federal government that they are distributing out ventilators as they see the need in the states. So they have asked states to be very specific in terms of how many ventilators they need at what point in time to try and balance all of the needs across the country. The governor has also been very aggressive in seeking ventilators outside of the national stockpile. So there are some companies in the U.S. that make ventilators. Actually, a lot of the parts that are used in making the ventilators do come supplied from overseas. So we're trying to be as aggressive as possible in getting ventilators in, but it is still a challenge. There's another area in which we've been chasing supply, and that is in the swabs and the test kits, trying to make sure that we have enough here to continue with the high level of testing that we have going on right now. In terms of a testing center update, many of you probably saw that the facility in Shrewsbury at the CVS has been closed. That closed end of day yesterday. That site had the ability to process between 100 and 200 people a day. They are moving all of the folks who were working there up to a site in Lowell at a showcase cinema where CVS can service 1,000 people a day. That's a partnership between the Commonwealth of Massachusetts and CVS. Unlike the site here where the tests were sent out to Quest Diagnostics in Marlborough to be done, and it took anywhere from 48 hours up to 6, 7, 8 days, I had heard. The tests that will be done in Lowell are the rapid tests that were developed by Abbott Labs. Those tests give a result in 15 to 30 minutes. So people will wait on site at the Lowell Showcase Cinemas testing site to get feedback on whether or not they tested positive or negative. There's several other sites that are being set up across the Commonwealth. One was opened in Foxborough in the parking lot the other day at Gillette Stadium, and that is for first responders. At the end of the day, if you need a test, your doctor, if they prescribe it, will tell you where to go to get that test. There are still many places here in central Massachusetts to get the test. The one at CVS in Shrewsbury had been dedicated first to first responders and healthcare workers only, and then just recently had been opened up to vulnerable folks who were 65 or older who were experiencing symptoms as well. In addition, at the state level, to certainly the leadership of the governor and the lieutenant governor, Secretary Sutters was put in charge of the command center by Governor Baker several weeks ago. She does a weekly call with legislators as well as we have a working group at the State House who compiles all the questions from legislators, and those get funneled over to Secretary Sutters and her team, and so that all questions asked by each legislator are put on a piece of paper. The answers are then put on that same piece of paper, and we are receiving those answers back out. So there may be questions that I asked that another legislator hadn't asked, but they will get distributed to all of us and vice versa. So sometimes there are things that people have asked that I haven't even thought of yet, so I'm happy to see that they have asked it and we've gotten an answer from the command center. But we're trying to share the load so that we don't have 200 legislators asking the command center the exact same question and them having to have capacity to answer all of us. Instead, we are funneling all our questions to a few colleagues who are then sending that information to the command center, getting the answers, and then sending it back out to all legislators. We're very conscientious of capacity issues at the command center, and we want them focused on the most immediate and pressing needs that they have, while we still do need to get answers so that we can serve our communities. In addition to answering questions on an ongoing basis, the Command Center also sends out a nightly situational analysis. It is generally a 5 to 7 page document. It comes in color. I printed it in black and white. This is an example of the other day. And it provides us, everyone in the legislature, as well as everyone else who's on the distribution list, an update on what happened that day, what are some of the key issues that they're focused on, and what we can expect to see coming up as well. It also recaps the numbers for the day. In addition, at 4 o'clock every day, and it's generally just about 4, sometimes a little bit before and sometimes a little bit after, the Command Center post online and at a site that everyone can access through mass.gov. If you go to mass.gov and you look right at the top, there's a yellow banner that talks about COVID-19 coverage. You can link right to this report. And it goes through and it provides an overview of the numbers for that day, as well as a breakdown into each of the counties in the Commonwealth where COVID-19 is present. When I reported to you back on March 15th, we had at that point in time only 475 tests done in the Commonwealth, and they were all processed through one lab, the state lab. Today alone, we tested 4,915 people for a total to date of testing of over 81,000 people in the Commonwealth. And those tests are now being done through 25 labs in the Commonwealth as well. Sadly, we have 96 people who lost their lives in the last day, so we are up to 356 lives lost in the Commonwealth due to COVID-19. We have 15,202 people in the Commonwealth who have tested positive for COVID-19, and of that, 1,172 of them are in Worcester County. We expect, and I know a lot of you have seen, that the next few weeks are going to be a peak period of time here for us in the Commonwealth. And I'm going to talk through why in just a minute. But to close out the conversation on what we're doing with Secretary Sutters, again, I want to really reiterate the speed at which her staff and the staff who are working the Command Center have responded to this pandemic. It is really incredible. State government in Massachusetts is working very hard and very well. And I feel it's my responsibility to make sure people understand. A lot of times people think folks in state government aren't working all that hard. I can assure you that people care enormously who work in state government, and they are all working extremely hard. In addition to the members of the administration, we have weekly calls and emails with the Speaker of the House. He convened a call with us last week to discuss the status of things. As you know, we operate on 2-year legislative session cycles, so we are in the second year right now. We were traditionally end formal session on July 31st of this year. When we are not in formal session, we are in what's called informal session, and that continues year-round at a minimum of twice a week. This week's session is Monday and Thursday. It is my week to cover session for the Republican caucus, so I was one of 5 House members who were present in the chamber on Monday. I will be back there on Thursday of this week to cover again. We processed several bills in our session on Monday. Some of them were local bills that we're moving through, other where we adopted some resolutions that had been filed, and we also advanced some bills that had been filed and were in the Rules Committee, and those were advanced out to the committees that needed to respond to them. As you can imagine, for the most part, everything that we are doing right now centers around our COVID-19 response. Because we are in informal session, what we are taking up are largely bills that have been vetted as much as possible through the committee process and through the leadership, and who are not having anyone who's holding them up. When we're in informal session, any one member could enter the chamber, and if there was something moving that they didn't want to have moved, they could do what's called doubting the presence of a quorum. And that would require that all members be present to do a roll call. So there are checks and balances on the ability to advance pieces of legislation. Some people have expressed a concern to me that because we're in informal session, the pieces of legislation that might be controversial could be moved through. That will not happen, again, because we have these checks and balances in place. So if there was any one member of the party, whether it's a Republican or Democrat, who did not want a piece of legislation to advance, they alone can stop that piece of legislation from advancing in an informal session. The challenge for us in moving into a formal session, which is what we would traditionally be very active in right now, is that our Constitution requires us to have a quorum and to be an assembly. So again, a quorum goes to the fact that they want us to have a quorum of our membership there. There are 160 members of the House, there are 40 members of the Senate. And the assembly language speaks to the fact that we are supposed to be together debating and voting on these bills. One of our challenges right now is that we've never had case law explore how we might think about that differently than actually physically being together. So there are folks in the House and the Senate who are working together to try and come up with some alternatives on how we could meet. I know it seems rather silly that we couldn't just figure this out, but we do have a constitution in place that we need to adhere to. So some of the things that we're exploring right now, if you are ill and yet you want to be recorded on a vote, you can be in the State House in your office and have a court officer vote for you. We're exploring the possibility of what if legislators were in their individual offices and we let court officers know how we wanted to vote on a piece of legislation. Another could be that we could be in our offices and there could be some sort of capability internally to signal what our votes are. The other piece that's being explored, again, is whether or not we should go past our July 31st deadline. That is a rather easy one to do. We can be called into emergency session, so if we're not able to get the work done that we had wanted to get done by July 31st, the Speaker could extend us into formal session past the July 31st date. The reason why the July 31st date has existed in the last number of years was to, A, provide focus to the legislature and focus on getting our work done by a certain point in time, but also because we are in an election year. So with the November election coming up, there has always been a desire to not be in formal session after the end of July so that people have time to be out in their communities and campaigning. So we remain up in the air on how and when we'll move back into formal session, but it is being looked at. Despite being in informal session right now, we have moved a number of critical pieces of legislation through. I mentioned to you when I was with you on Sunday, March 15th, that we had voted through a $15 million in supplemental assistance going directly to the Department of Public Health, both for their use and to get out to local and regional boards of health for their work in fighting the pandemic. We also passed legislation that waived the 1-week waiting period for unemployment assistance that had been in law. We passed a piece of legislation on municipal elections so that cities and towns could move the date of their election. Westboro had originally been looking at their election in March. We actually worked with a judge to get that date moved. It hasn't been scheduled yet, but the ability to move it, because we had not yet passed at the state level this legislation that I'm speaking about now. Shrewsbury's election is the first Tuesday in May. With this legislation passing, the town now can set another election date as long as it falls before June 30th. As we advance in time, if for some reason that the June 30th date would become problematic because we would still be in the midst of a pandemic, we in the legislature would look at moving that date again. In addition, we passed legislation last week and the governor signed providing municipal governments with some additional flexibility in terms of both operationally and in terms of governance. So the legislation allows town meeting to be moved. Prior to our voting last week on this legislation, town meeting was required to be done by June 30th, being the fiscal year for both the state and municipalities. We've now provided flexibility that town meeting can be moved past June 30th. Because of that flexibility, we also are giving cities and towns the ability to do monthly budgets, similar to what we have done at the state at certain times, where you do a 1/12 budget. States, municipalities can advance a monthly budget to be used, which is based on the prior year, or in this case, our current year spending levels. In addition, that legislation also included the ability for restaurants to sell unopened beer and wine, and it moved the April tax filing date to July 15th, which I'll touch on in a moment. In addition, we have several pieces of legislation that are currently pending. One of them is an education bill that the House passed last Thursday. It's now pending in the Senate. That bill has several pieces to it. One of the ones that is most talked about is it includes a requirement that the commissioner of the Department of Elementary and Secondary Education would either modify or waive the MCAS requirement for this year. Any of you who are parents probably know that MCAS are required. They would already be underway now here in the Commonwealth. My son, who's in 8th grade, I think was scheduled to have either ELA or math the first week in April, and the other one the first week in May. So we are looking to have that legislation advance. As I said, it has passed the House, it's pending in the Senate. I'm hopeful that perhaps on Thursday, when I'm in covering informal session, that this bill would move through the Senate and come back to the House. Pieces of legislation have 2 votes. When they get taken up, they are engrossed on the first vote, and then they go to the other chamber. When the other chamber engrosses, they come back to the first chamber where it originated in, and it's called enactment. So hopefully the Senate would engross the legislation on Thursday, the House would stay in session to enact this legislation, and then the Senate would stay in session to enact it, and then we could get it to the governor's desk. In addition, we also passed legislation last week in the House that would provide a moratorium on evictions and foreclosures during this pandemic to make sure that we protect people who are living in a situation where if they can't come up with enough money to cover rent, they are not started with eviction proceedings while the pandemic is going. In addition, Senator Moore and I have filed, he filed it in the Senate and I filed in the House, legislation that would require the Commonwealth to cover the overtime costs for municipalities for any of the public safety and law enforcement officials who have had to work overtime as a result of this pandemic. The other big piece, of course, for the legislature, in addition to working on legislation, is the budget. As you know, working on the budget is a almost all year round time-consuming effort. We start in December by gaining a consensus revenue where all of the major parties, the House, the Senate, and the administration work with outside economic experts and come up with what we believe to be the best case guess or estimate on what the additional revenue situation will look like in the following fiscal year. And then the governor files his budget in January based on that consensus revenue number. This year, the governor filed, when he spoke, his State of the State at the end of January. He filed his budget. In February, the House and Senate Joint Committee on Ways and Means, of which I am a member, we got underway with our 8 statewide hearings that we have. We take different pieces of the budget and we cover them in full in a hearing. Almost all of the hearings had been held when the pandemic kicked in at a rate that we had to close the State House and require folks to work remotely. There were 2 more hearings that were scheduled to be held that we did not have, one in East Brookfield and one at the State House. Generally in April, the House would be taking up the budget, and in May, the Senate would be. Because of the situation at hand right now, we don't have a time frame for when we're going to take up the budget in the House or the Senate. Our best case thinking right now is that we will do it as soon as possible. Whether or not that would be before the traditional timing of the closing of our fiscal year, which is June 30th, is unknown. In the past few years, because we've been late in getting our budgets done, we have done 1/12 budgets for the months of July, and I think last year we did August as well. So there is certainly precedence for us to operate on a 1/12 budget, and it's very possible that the governor would file a 1/12 budget that would be voted through in an informal session. That budget would likely contain what would be the bare necessities of continuing to operate state government. When we gather finally as a House to debate the budget. The guidance that a lot of folks have given us is to think back to the period of time in 2008 and 2009 when we were in a recession. And the budget that was adopted was very much a budget that was only what needed to be spent to keep the core elements of government going. And it did not include any special earmarks. So things that are earmarks are generally thought to be things that aren't necessary. I can tell you that in the last 2 budget cycles, I've secured a $50,000 earmark for Shrewsbury Youth and Family Services both years to continue their youth mental health first aid training across the Commonwealth. They've done that in many communities for many different school systems, public safety officers, as well as institutions and administrative departments such as the Department of Children and Families and youth groups, so the Y, boys clubs, girls clubs. I would argue that that is not fluff money. That is critical funding that's coming through in the form of the earmark. But again, the likelihood of us having any of those additional opportunities to earmark funding in the state budget for this coming fiscal year 21 budget cycle are probably going to be severely depressed to nil. So what that will also mean is that as we move forward in the state budget process right now, I mentioned earlier that we had moved to be in alignment with the federal government when they moved the tax filing deadline to be July 15th. That was rather easy for the federal government to do because, quite frankly, they operate on a fiscal year that ends September 30th. So by moving from an April to a July timing, they are still within their fiscal year. The federal government also does not have a balanced budget requirement as the state of Massachusetts does. So it was an issue for us to think through how would we move from an April timing to a July 15th timing. July 15th is beyond the end of our fiscal year, which is June 30th. And it also, not having that revenue come in, puts us out of whack with having a balanced budget. To get around that situation, the governor has filed legislation to float what's called revenue anticipation bonds, which basically says that we will put these bonds out in the market, get the money in that we need to cover the lack of revenue coming in. And then once we do get that revenue in, July 15th, the bonds would be paid off by that incoming revenue to be an offset to them. Revenue anticipation bonds have been around for a very long time and used in many different capacities. So this is a good fiduciary way to bridge this gap. We are aware of the financial situation that people find themselves in right now, and we've tried to do whatever we can to be responsive to that. This is just one of those steps. We also, for small businesses who pay meals tax or occupancy tax, put off those tax dollars coming in as well to later in the cycle. This also has implications certainly for the municipal level as well. And there are many municipalities right now who are looking at their own budgets, including Shrewsbury and Westboro, and making sure that because of the changes that are being done at the state level, that they're still able to meet their needs on the local level. The governor and the lieutenant governor, as well as the House and the Senate, have been very clear that protecting local aid and education funding is absolutely essential, no matter what the scenario we are in. But there are some other things that will be offset as we move ahead. In addition to moving the deadline for tax revenue to come in, we are certainly going to see less revenue coming in through sales tax. We've already seen our lottery numbers decrease substantially, and that will continue. And that is a big piece of what does fund our local aid numbers. So again, we would need to offset that in the state government with other dollars. And then we will also see, no doubt, a hit to capital gains coming in. So there are many different pockets of revenue that the state relies on to build a budget that are going to be experiencing difficulty as we move ahead. In addition, the state is incurring much higher costs in some areas than we would traditionally see because of our need to respond to this COVID-19 pandemic. So in the next few months, we will move ahead. Again, as a member of Ways and Means, I will be very closely working with my other colleagues in Ways and Means to make sure that we can build a budget that we can sustain through the next year. One of the best things that we have going for us is since the Baker-Polito administration came into office, when they came in, we were under $1 billion in our rainy day fund. We are now over $3.5 billion. We've been very diligent about putting funding into our rainy day economic stabilization funding at the state level for two reasons. One, we wanted to have this cushion, and I think we are the state with the fourth highest amount of rainy day funding put aside. Second, it matters to our credit holders, the bond rating companies, that we have a sufficient amount of money set aside to deal with a situation just like the one we have here. And so having those funds there has also enabled us to have better rates on our bonds when we go to market as a state. So we were supposed to have today actually a virtual Ways and Means public hearing to hear from economists on what they see as the impact for the rest of fiscal year 20 as well as fiscal year 21. Unfortunately, there was a system technology issue at the State House and the hearing was not being able to be broadcast. So we are now holding that hearing next week. I have not been told yet what date and time it would be, but I will certainly post that when I have that information. In addition to the other levels of communication that are ongoing in working groups at the State House, the Food System Caucus, of which I am a co-founder and co-chair, and has a membership of 131 out of the 200 members of the legislature, has also been working with our partners outside of government, so advocacy groups and organizations, the food banks and food pantries, to understand what are the critical impacts that are happening all across the Commonwealth to the food system. Tomorrow afternoon, the co-chairs of the caucus, there are 5 others along with myself, we will be doing a call and working on some of those issues that are before us and making sure that we are advocating at the state level for what the needs are to make sure that as much as possible we are supporting those out there on the front line, both who are on the side of helping people who do not have enough access to food and those who are producing the food, our farmers and our agricultural communities here in the Commonwealth. At the local level, I am in close contact on a near daily basis, certainly with the Board of Selectmen and the School Committee and the Finance Committee members. I'm sending them information as soon as I have it and keeping them up to date on what is happening at the state level. The town managers in both Shrewsbury and Westboro, I'm in contact with certainly very often. Spoke to both of them today regarding some public health issues. In addition, the superintendents and certainly Superintendent Joe Sawyer in Shrewsbury have been in very active communications with regarding some of the work that's being done at the state level on the education bills, and our folks on the boards of health and who are assessing the numbers that we have here in our communities of people who are impacted and affected with the COVID-19 virus, as well as those who may have been exposed to them. And one of the things that you may be aware of is our local Board of Health are also authorized to share with our first responders the addresses of where there is a person living with COVID-19. And that is so that we can protect our first responders and they are aware if they are going into a situation to respond, whether it's a police, fire, ambulance, that there may be somebody in the house who is COVID-19 positive, and that way they can take the protections that they need. We are trying very hard to make sure that our first responders are not exposed to this virus any more so than is dictated by lack of knowledge at the time if somebody is COVID-19 positive, because certainly our folks on the front lines need to stay well, and when one of them gets sick, chances are they could have spread it to somebody else before realizing they were sick. So we're working very diligently to make sure we're protecting our first responders. Finally, I would say at a local level, working closely with Shrewsbury Youth and Family Services, as well as St. Anne's Human Services and the Westboro Food Pantry. SYFS would generally be having their gala in May. It is where they raise 1/3 of the operating revenue for the year. Because they are not able to hold that gala, they are doing an online fundraising effort right now. It has been shared many times on Facebook. I will include the information on this show so that you can see where to go to donate. But I would ask you to think about whether or not you and your family have any capacity, whether it's a $5 donation or a $5,000 donation. Any ability to donate to SYFS will be of help. In addition to not having the gala, Some of the other ways in which SYFS earns revenue are also not able to be done because of schools being closed and because of not being able to provide some of the training and group settings that they would usually do around the youth mental health first aid training. So again, very critical to support that agency in our community who touches so many people's lives. In particular, right now, mental health challenges will escalate in such a time of high stress and anxiety for people. So I encourage you in any capacity that you have to please join me in donating to SYFS. In addition, St. Anne's and Westboro Food Pantry are on the front lines for us helping vulnerable people in our community who do not have enough access to food. Both St. Anne's and Westboro Food Pantry are accepting monetary donations as well as donations of grocery store gift cards. Again, anything that you can do to help out people in our community would be a huge help to these agencies who are making sure that those folks who already were suffering from lack of access to enough food, as well as people who, because of the COVID-19 pandemic, may now find themselves in that situation. The numbers who Westboro Food Pantry and St. Anne's are serving is rising. So any help that you can give to them locally would also be of enormous assistance. In addition to the partners at the federal, state, and local level that I work with, also very much connected into the healthcare system, in particular for us, UMass. UMass hospital system is the largest provider of jobs in central Massachusetts from an employment perspective, as well as the largest provider of healthcare. They have done a tremendous job in the last couple of weeks responding to this pandemic. And I want to walk through some of the things that they've done, but I first want to share with you, there's a weekly call with UMass. And last week, Dr. Dixon, who is the CEO of the UMass hospital system, spent a bunch of time talking to us, really reiterating where we're at right now in terms of response to COVID-19. He reminded us that COVID-19 has a long incubation period, between 5 and 14 days, and that up to 3 days before anyone shows any symptoms, they can be shedding, or in other words, they can be spreading the disease to other people. That is one of the reasons why the recommendation to now wear a mask when you are out in public. That is both so that you are not exposed to others who may be having, who may have COVID-19 but are not symptomatic yet and are unaware that they are spreading the disease, as well as for yourself if you were COVID-19 positive but you did not yet know that because you weren't symptomatic and you're out in public. So I encourage people to heed the advice of the CDC and wear a mask whenever they are outside. I would also tell you outside the home and in any other setting, wear it. I would also share with you that wearing a mask does not replace the need to be socially distant, or I prefer to call it being physically distant from those around you. And that 6 feet should be considered a minimum, not a maximum, for the amount of space that you should allow between yourself and other people. Dr. Dixon said that generally when people become symptomatic, it is most usually with a fever and a cough. Some people also have a runny nose and sore throat. Some people are nauseous and have gastrointestinal issues. And some people will lose their taste and smell. Dr. Dixon shared that about 15% will progress to getting pneumonia. And that once people are placed on ventilators, it is very, very difficult to fight this battle against COVID-19. As we talked about earlier, we are doing as much as we can to get as many ventilators here in the Commonwealth as possible. Our greater goal is to prevent people from needing a ventilator. If we can keep people from requiring a ventilator, we can ensure that they will have a more rapid recovery from COVID-19. Dr. Dixon shared that the people in the hospital today are the people who contracted the virus nearly 4 weeks ago. So when you hear this discussion on the peak that is coming, the reason that the peak is coming in the next 2 weeks is because that will represent before we started doing all of the measures that we undertook to prevent the spread of the disease and to flatten the curve. So the people who are going to be starting to enter into our healthcare system in the next 2 weeks are folks that the disease was spread to before social distancing, certainly before masks, and before we had shut down on the state level all non-essential business work going on. The entire reason to do all of these measures is to not only prevent people from getting sick, it is so that we have the capacity to deal with people who are sick in our healthcare system. There is a capacity issue. We can only deal with so many people being sick at one period of time. That is both a physical issue in terms of having the actual space to keep people in our healthcare system, as well as the number of healthcare professionals who can care for people. We've done an enormous amount of work at the state level to free up as many healthcare professionals as we can. By executive order, the governor has allowed people to practice up to the top of their profession. We have given physicians assistants some flexibility in terms of who they report under during this period of time. Instead of being under one specific doctor, they have flexibility to help out in different capacities. We also graduated from UMass last week, a couple months early. I think 135 of the fourth year medical students, that's being done across the Commonwealth. I watched that graduation ceremony online. It was a virtual graduation ceremony for UMass medical school students. It was pretty moving. And those students are now moving right in and working in our healthcare system so that we can increase the number of staff members that we have within the healthcare system to help respond to this COVID-19 virus. In addition, you have probably seen that the DCU in Worcester has been turned into a 250-bed field hospital. UMass is hiring between 250 and 500 people to staff that location so that we can provide healthcare to people who are sick. In addition to that, a number of moves that were made in Central Mass and most specifically in Worcester itself were to provide some additional housing options for people who have been present in our homeless shelters, to provide some additional space so that people are not in such close proximity. Again, not only is that the humane and right thing to do, it is also an effort to make sure that we are not enabling quick spread of the virus among a very vulnerable population. There has also been effort to provide a nursing home dedicated to folks who are battling COVID-19 so that we are keeping folks who are present with the virus away from people who are not currently present with the virus in our nursing home setting. We are also doing those things across the Commonwealth. In Boston, the Convention Center, there is a 1,000-bed field hospital being opened, which I believe makes it the largest hospital in the country right now. The DCU facility will open on Thursday as a hospital system here for us locally. In addition, one of the things that the Baker-Polito administration did as well was to authorize telehealth. That enables people who have other healthcare issues that need to be dealt with that don't require being physically present in sort of an emergency care situation. So it's not to prevent somebody from going to the emergency room who's in a life-threatening situation, but it is meant for people who might be battling something else, whether it's strep throat or they need to talk to their mental health provider. Those things can be done through telehealth now. The coverage is the same. And so that, again, keeps people out of unnecessary interaction in the healthcare system with people who might be COVID-19 positive. And again, it protects our healthcare workers who are not having to be present with people face-to-face, but who can provide that same service through a telehealth capability. Finally, I would tell you that the greatest challenge that I deal with on a day-to-day basis is helping constituents who are facing an unprecedented time of crisis in their life. Many, many people have lost their jobs or been laid off due to the COVID-19 virus. Small businesses are struggling. They are trying to figure out if they are eligible to apply for some of the federal loans that were put into place through the CARES Act legislation, as well as other loans available through the Small Business Administration. And we at the state level have some lending capability as well. But it is a very difficult time, and I fully understand that, as does my legislative aide, Anna Darrow. We are online, on Facebook, on email, via text, Facebook messaging. Any form of communication that you want to use to reach us, we will respond to you. I will again include here the different ways that you can contact us. You can certainly call my office and leave a message there. We check that voicemail several times a day. You can also call Anna and I on our cell phones. You can also email us directly. We are responding to people as soon as we see a form of communication come in. We are not always able to get answers immediately. I'm sure you can understand the impact that has happened on state government in response to this as well. So I mentioned earlier that state government is working as hard as possible to respond. One of those critical areas is in unemployment. Prior to COVID-19, the unemployment folks had about 50 people working in their call center on any day, helping people who are having issues applying for unemployment. Right now, and those people were all together in one building physically, the 50 of them working in a call center. Now we are working remotely. We have 500 people in state government, many of whom were not working in an unemployment capacity prior to this, who are fielding phone calls and working to help people who are trying to apply for unemployment assistance. So there is a significant backlog. We have had a volume of people applying for unemployment assistance, which is unprecedented. And we are doing the best that we can to help people work through all of these issues. I apologize. I know it's stressful. I know having to wait any period of time is really difficult, but please know that we are working as quickly as possible to get you answers and to get help. One of the common issues I have seen of people applying for unemployment is that when they enter the name of the business they are working for, they're entering the name that they know it by, as opposed to the name that is on your W-2. If you are applying for unemployment assistance, make sure you get out your W-2 and you look and see what is the business name listed on your W-2. When you apply for unemployment assistance and you enter this information electronically, the state is looking to match the name of the employer that you have entered with the name of the employer who has been paying unemployment into the unemployment fund. Those two things need to match up. That is a very quick fix that you can do through the portal on your own application without having to wait for a callback. So if for some reason you are waiting right now and you have an error and you haven't seen your claim processed, do check and make sure that you have the right business name there. In addition, we are still waiting for guidance from the federal government. We did receive some over the weekend, and the state is working to put that guidance into the system so that we can also give the $600 additional a week to people who qualify for unemployment, who are already receiving it or already eligible to receive it, as well as adding in the capability to the system to provide coverage for people who are self-employed, sole proprietors, or are paid via a 1099. It is more difficult for the state to complete an unemployment claim for someone who is coming in as self-employed or having a 1099 because, quite frankly, there's nothing paid into the system. So there are some more checks that need to be done to make sure that we have the accurate information we need to pay out a claim. So again, I would ask you, once we are able to turn the system on for those folks to apply, to make sure that you have all the information that's being asked for by the system so that we can as quickly as possible turn around and get those checks out to you. In general, you have a number of choices to make as well. Whether or not you want to have taxes taken out, that will be one of the questions you're asked on the system when you're applying, and whether or not you want to do direct deposit. My understanding is it typically takes 9 days or so to get your first check, whether that's a physical check or through direct deposit. And then once that initial deposit is done, you're on a regular and standard weekly payment cycle to happen. Again, any issues that you have, please reach out to my office and we will help you as much as possible try to get any unemployment or any other issue resolved. And certainly small business owners as well. I understand the challenge. I'm a former small business owner myself. I can't imagine the situation that you're in right now with the stress of knowing whether or not you're going to be able to keep your business afloat, keep employees paid, and keep your doors open when this pandemic is over. So please do reach out if there's anything that we can do to help you. Finally, I would just like to offer a couple thoughts on what we can all do to help. First and foremost, I would stress again, using social or physical distancing, not leaving your house if you don't have to. If you do not have to go to a store, please don't go. If there are other means to accomplish what you need to get done, whether that's electronic or over the phone, I would encourage you to do so. I do know myself it's been a challenge to order groceries online. I'm trying to limit my run to the grocery store to once a week. I have also been using for a number of years now a HelloFresh as a delivery system for food a couple days a week. So I'm taking advantage of that now as well so that I can cut down on the number of times I have to go out to the grocery store. But if you do go out, please make sure that you wear a mask. This mask was actually made for me by one of my colleagues' mothers in the State House. My mother-in-law has also made masks for our family. I understand that it's not that difficult to do if you have any idea what you're doing. I am not someone who is talented in terms of sewing, but there are a number of instructional videos out there for people on how to make a mask. If you can't physically make a mask, a scarf, a bandana, any of those things is a great substitute to wear when you're going out. I would also plead with you to not wear and use masks that are needed in our healthcare system. We don't need that level of protection when we're going out to do our errands. We need to make sure that our frontline responders, our healthcare system workers have those available to them so that when they are presented with somebody, they have that protection. I would also encourage you when you are out, if you're going for a walk, again, please do try and keep distance between folks. I would encourage parents to keep stressing with their children. I took a noonday walk today with 2 of my children through Dean Park, and I did still notice a number of kids who were congregating there, not many, but still a few. I know it's really difficult. I have 3 teenagers myself, but please, parents, help us keep down kids being out there together, because even though they themselves probably have a lower risk of falling victim to COVID-19, they do easily spread it to other people in the family. I would also ask you, if you are living in an environment where you don't have a single entry into your home, so if you're in an apartment building or in an area where you enter in through a common door before you go to your own front door, that you be really cognizant and careful because, again, COVID-19 is very easily spread. I would take whatever precaution you can. I would not assume fully that any cleaning that's being done by a property owner is sufficient. I'm sure everyone's doing a great job. But again, if you're going in and out of common areas, if you need to touch and open doors, I would encourage you to take precautions doing that as well, just to, again, provide that extra level of protection for yourself in areas where people are closely either living together or accessing common ways to enter homes. I would also ask folks who are home and who have capacity to think about how you might be able to give. I've seen a remarkable number of really inspiring and amazing stories of people in our community and in others who are stepping forward to either secure donations of personal protective equipment, food donations, goodie bags for people who are working in the healthcare front lines. And by goodie bags, I mean essentials that they need to keep them safe. These are all really amazing efforts, and I am so appreciative of each and every person who has undertaken this. For those of you who have not yet seen this, you can certainly find out through a lot of these efforts, through many of the community forums that we have in Shrewsbury and Westboro. There are also many opportunities to assist in the greater community area. UMass is always looking for donations, and they have on their website several ways in which you can donate. The state has put up several ways in which folks can donate, and you can access those through mass.gov. And I would also say that if your children are looking for a way to help people, that we still have an awful lot of people who are unable to visit with family and loved ones who are in congregate care, whether it's a nursing home or assisted living, who a card decorated by a young person would brighten their day. And there are several efforts. I know in Shrewsbury through Sherwood, I have seen postings about some of the groups there who are working to supply cards to folks who are shut in and unfortunately unable to visit directly with their loved ones at this time. I would also ask you, if you are a person who needs help, not to be shy about asking for it. This is unprecedented time, and people who may never have had to ask for help before may need to ask for it now. Please ask for help. Don't be shy. There are so many people who want to help. Again, I've seen numerous examples of people who are delivering groceries or picking up prescriptions for people who are unable to otherwise get out. People are happy to help each other. People just need to be asked. If you need help and you are unsure of where to turn to get that help, please call my office. Call me, call my aide, send us an email, however you want to communicate with us, and we will help you get that assistance. We are happy to make connections for people where there is a need. And finally, I would remind you again, if you are able to donate to Shrewsbury Youth and Family Services, to St. Anne's, or to Westboro Food Pantry, to help us do that in our community as well. I will continue to provide updates on my State Rep Facebook page. I send out a weekly email specifically on COVID-19 and what the response is and what we're doing. I try to send that every Wednesday or Thursday. I'm due for another one this week, which would be my 4th update. And I will try to continue opportunities like this to personally provide an update on what it is that we're doing at the state level. I want to thank you for the opportunity to serve you in this capacity. It is my greatest honor to have the opportunity to serve as state representative for the communities of Shrewsbury and Westboro and the people who live in these communities. And I want to encourage you again to not hesitate to reach out if I can help you or my office can help you in any way. I hope that you are well. I hope that you stay well. And I will be back in touch very soon with all of you. Thank you.